Assalamualaikum warahmatullahi wabarakatuh. Hello guys, my name is Riyan Bayu Pramudya. I'm from S1 Nursing Class B, and I make this video for completing my semester test. I will explain the material of measuring a person's respiratory rate. First of all, need to know the purpose of measuring the respiratory rate is to find out whether someone has problem breathing or not. The respiratory rate measurement is done by counting the number of expansions of a person's chest to take a breath in 1 minute. Measurement of respiratory rate is generally done at risk. The respiratory rate may increase due to exercise, fever, lung disease, or other medical conditions. The normal rate of breathing in adults, children, and infants is different per minute. Not only stop at the breathing calculation, but we also need to see whether breathing is difficult or not and see whether breathing is regular or not. Immediately, we go to the first point, which is about counting breath. Breath calculations are done by measuring breath per minute or BPM. To get accurate results, the person needs to rest. That means he's not breathing any faster than usual from working out. He should stay still for at least 10 minutes before you count his pulse. The steps are: first, have him sit up straight. If you are measuring the baby's respiratory rate, lay the baby on his back on a firm surface. Second, use a stopwatch to count breath for 1 minute. Count the number of times the person's chest rises and falls in 1 minute. Third, if you tell the person that you will be measuring their breathing rate may change without them notice. Ask him to breathe normally. To increase the accuracy of the results, you can perform the calculation 3 times and calculation the average of the results. Fourth, if you have limited time, count the breath in 15 seconds. Multiply the number of breaths by 4. This will give you a close breath per minute estimate and is useful for emergencies. This applies if the breath is regular. If it is irregular, then the calculation must be carried out for 1 full minute. After counting the breath per minute, the next step is to determine the normal breathing rate or not. How to calculate it is to compare the rate of breath per minute with age. First, 30 to 60 breaths per minute or BPM for infants 0 to 6 months. Second, 24 to 30 breaths per minute or BPM for infants aged 6 to 12 months. Third, 20 to 30 breaths per minute or BPM for children aged 1 to 5 years. Fourth, 12 to 20 breaths per minute or BPM for children aged 6 to 11 years. 5. 12 to 18 breaths per minute or BPM for pupil 12 years of age or older. The final point is to look for signs of breathing problems. If a person's breathing rate is higher or lower than his estimate range and he hasn't exercised in a long time, this could indicate a problem. Other signs of breathing problem include: 1. The nostrils inflate with each breath. 2. The skin is a bit dark in color. 3. The ribs and the center of the chest are pulled inward. 4. The person makes grunting, growling, or crying sounds when breathing. 5. The lips and or eyelids are blue. 6. The breath with the wall, shoulder, or chest. This is considered breathing with effort. So friends, this is the material I can convey about measuring the respiratory rate. Thank you for your attention. See you in another video, and Assalamualaikum warahmatullahi wabarakatuh.